through. Okay, so as I said, I'm here today. My name is Barbara Dooley. I'm part of the YouLEAD group, which, as I said earlier, is a consortium across 3 universities, RCSI, UCD and NUIG, being led out by NUIG, looking at youth mental health, and it's called the YouLEAD program. And this is our seminar week. And today I'm being co-chaired, my co-chair with me is Molly Greeno, and she is the SU welfare officer here in UCD with a particular interest in mental health. And I know from her campaign earlier in the year before she was elected, she was making mental health one of her things that she really wanted to focus on. So we're delighted to have Molly with me today. Molly will moderate the Q&A and I will hand over to her once Sarah has finished, and she will take through all the different questions. And Molly herself was originally from Boston, has finished her law degree here in UCD. So Molly, it's great to have you with me today on this session. And I'm going to just introduce our speaker for today. Our speaker today is Dr. Sara Evans-Lacko, who is an Associate Professorial Research Fellow in the Care Policy and Evaluation Centre at the London School of Economics and Political Science. Her research focuses on new and diverse ways of improving access to care and support for young people with mental health conditions or at risk of developing mental illness. A key factor underpinning low levels of access and disadvantage faced by people with mental illness is the stigma embedded in structures, institutions, policies, and cultural attitudes. And her research aims to contribute to the evidence base and how we can reduce the stigma which generates and reproduces inequalities between people with and without mental illness over the lifespan. Her current and planned projects address this question in a variety of ways. First, using longitudinal cohort data to estimate the social and economic consequences of mental health problems over the life course, and to explore their interactions with key risk factors, precursors, and other vulnerabilities. These findings can increase our understanding of the dynamics of the life course to identify key time points for intervention and investment. Her research also continues to develop and evaluate relevant interventions to reduce stigma and improve access to care and support. So as you will see, a real expert in this area. So I'm going to hand over to Sarah for her presentation, which will be around 35-40 minutes, I think, give or take. We look forward to some questions from you who've joined us here later at that point. So over to you, Sarah. Thank you.
Thank you so much for the introduction and for the invitation, and yeah, to everybody for coming today. Sorry, multitasking, making sure the slides are okay. But no, I agree. This is a really wonderful initiative highlighting youth mental health research this week. I also couldn't attend last year because I was giving birth in the hospital to my daughter. So I'm really delighted that I was invited again and can participate this time. And yeah, I'm going to be talking about, of course, with this focus on stigma, but also thinking broadly about barriers to care for young people with mental health problems. So what I want to do today is first talk about why it's important to understand barriers to mental health care for young people. So just giving a brief context, which I'm sure many people on this webinar already will be familiar with, but to reinforce that I think is important. And then really start to discuss the facilitators and barriers to care for young people. In particular, thinking about how stigma is really linked with getting care and support. And then importantly, thinking about what we can do. Why does this issue matter? I think, especially now during the ongoing economic crisis, we know, mental health and youth mental health is becoming increasingly important. And even before this started, the most recent global burden of disease figures showed that worldwide mental health conditions have increased 50%. And much of this increase is driven by young people. So I think as many people may have seen this, but I think it really does emphasize that the burden of mental health conditions over the lifespan, so you can see they really emerge early in life relative to, in fact, to other types of health conditions. And moreover, these conditions really have long-term impacts on mental health, but also on other life chances, really limiting opportunities and life chances for young people. So these are data from the 1958 British birth cohort, so following young people up until age 50. And what they've, so this is a study by Alyssa Goodman, which I've adapted to a figure. But I think really importantly, it shows that these childhood mental health problems persist over the lifespan and represent really key drivers for, in this case, for net wealth. And what you can see is that relative to the other types of early problems, relative to low birth weight and other types of physical health problems, actually it was the child psychological disorders shown by this blue line, which have the most negative impacts over the lifetime on net wealth. And you can see this translates to other types of socioeconomic outcomes also. It's a complicated relationship, I think, in terms of maybe how early mental health problems are potentially impacting on educational outcomes, and then impacting on net wealth over the lifespan. But I think it's just important to highlight this, especially in terms of relative impacts of youth types of problems. And kind of alongside that, we know that young people, there's really limited access, limited use of care among young people. And actually that this age group, especially those aged around 18 to 24 years, that this is the group who is in fact least likely to use any care. So it's a time when a lot of mental health problems are emerging. As we can see from the previous data, that there are all of these other kind of life events that are intersecting and potential risk factors. But also as also young people are less likely to use care. And there's several different studies also done by the Galway group, which are showing this, I think. Here's data highlighted actually from the, we combined the adult psychiatric morbidity survey with the child adolescent mental health survey, which have nationally representative populations for England. And we can see that there's, especially for the 18 to 24-year-olds, they had the lowest access to care, and there was a real drop-off when they reached this age. So from 58 to 36% of young people who had a mental health condition and experienced significant impact who were using any type of mental health care. And of course, right, the access to care and support for young people really depends on several complex factors. So this is a simplified version, but just trying to highlight the complexity, I think in particular for young people. So of course, there are several types of youth characteristics which influence how they access care. But the young people, they also have this interaction with gatekeepers, and gatekeepers who can help support and facilitate care, but also can be barriers to care, including parents, including teachers. These gatekeepers, I think, are even more important for younger children, of course, who are not usually accessing care on their own. It's, I think, that 18 to 24 age group where peers start to become more important, and where they're seeking care independently, and one of the reasons that care drops off there. Then alongside that, there are these contextual factors too, which you really have to keep in mind. So all of the health system and provider characteristics, availability. Sorry, someone is raising. Shall I go through? Yeah, shall we do questions for people who are raising their hand along the way?
No, I think we leave questions to the end, Sarah. Yeah.
Okay, sorry.
Okay, no.
Great, thanks. And then, of course, there are structural factors also, thinking of those broader kind of societal impacts, which influence how young people both supply and demand, how they're accessing and utilizing care. So I'm going to focus less on the health system characteristics in this presentation. They're clearly important, both in terms of their ability as availability as a resource, all of the kind of healthcare provider confidence in addressing mental health problem and attitudes and capacity. But I think it's probably a whole nother presentation. So I'm going to focus less on that for this presentation. Okay, so thinking of those broad categories, how might these factors influence access to care for young people? And so I think first, if we start thinking about the young people characteristics, so in addition to, I think we know that persistence of mental health problems, severity of mental health problems, those are really robust predictors of whether young people get into treatment. And that's shown over and over in lots of studies, which is really important because it shows care is being targeted on those who are in need. Also, especially how mental health problems are impacting on young people's lives is really important for whether they receive care. But then above and beyond all of those more need-based characteristics and clinical characteristics, sociodemographic characteristics, independently, there are several studies now which are showing how youth stigma-related concerns, attitudes really contribute both to delayed help seeking and also delayed disclosure. So even really concealing mental health problems. And also importantly, these delays and attitudes really start early on. So Petra Gronholm and colleagues, we've done some work looking at young people who are at risk of psychosis, showing that the stigma influence, even among those early at-risk groups, are actually similar in relation to others with more established mental health conditions. And Petra's also led a systematic review, really showing how help seeking is actually impeded by stigma, even among those who have these really early signs and symptoms. And so young people, clearly their young people's beliefs, attitudes have an important role in whether they're getting care, even at these really early stages, which has clear implications for prevention too. But parents are also really important. There's less work looking at caregivers, parents, and other types of gatekeepers and how stigma among these groups might be important for whether young people get care. So we looked at this among a cohort of young people in the UK first, and we found that caregivers and extended stigma in particular exerted a strong influence on whether young people accessed services, and especially for those whether young people could get health services. I think really interestingly, we then did this work in Brazil, and I think the hypothesis there was, okay, there's a lot of other complications in terms of structural barriers in Brazil, fewer resources available, and that we kind of thought maybe stigma wouldn't be as important in Brazil, that they would be more about socioeconomic conditions. But we looked at the same questions in Brazil, and we found that actually for whether people received any type of care, actually parental stigma was one of the most significant factors. So yeah, in our analysis, actually socioeconomic characteristics in the multivariable regression were no longer important, and it was really parental stigma which was driving whether the young people got help and support or not. Of course, the other types of clinical characteristics were again important: severity, impact on everyday life. So I think that was important information. So even in these low and middle income country contexts, such as Brazil, stigma is still the most important barrier to whether young people were receiving any type of care. We then did look at those. So we have a lot of questions about different types of barriers along these pathways to care. And so then when we did look in the Brazilian cohort, among those who are already using services, the barriers were slightly different. So once young people got into care, the parental stigmatizing attitudes weren't as important. A lot of people, really importantly, 2/3 of the young people in the cohort who were using services still experienced some barriers. So they said the care that they were getting was not adequate, that they were able to get into care, but they needed more help and support. And for them, much of those barriers were really structural. So they were things around cost, around distance, around transportation limitations. Also important were issues around recognition and literacy. So parents didn't know where to go, didn't know who to ask, didn't feel their child's problem was serious. And then also there was issues around mistrust, around negative experiences from the past. So having previous bad experiences with professionals, thinking the service wouldn't work, etc. Okay, so now so those are, highlighting some of the key barriers. And if we think about then how do these factors really start to interrelate to influence access to care? Kind of to set the scene, actually, I want to just show a video. And this is, just trying to think about linking up these kind of structural barriers and social context with young people's attitudes and beliefs and what we think are these more personal attitudes and beliefs. So I'm going to stop sharing this and share.
In Brown versus Board of Education, the famous case that desegregated schools in the 1950s, Dr. Kenneth Clark conducted a doll test with black children. He asked them to choose between a black doll and a white doll. In most instances, the majority of the children preferred the white doll. I decided to reconduct this test as Dr. Clark did to see how we've progressed since then. Can you show me the doll that you liked best or that you'd like to play with?
This one. I like that one.
Okay.
This one.
That one?
This one. I like to play with this.
And can you show me the doll that is the nice doll? And why is that the nice doll?
He's white.
And can you show me the doll that looks bad? Okay. And can you and why does that look bad?
Because it's black.
And why do you think that's a nice doll?
Because she's white.
And can you give me the doll that looks like you? "15 out of the 21 children preferred the white doll.
Okay. So, I mean, the video, of course, was not focused on mental health, but I think just echoes such an important point about how early young people can internalize these societal attitudes, and that, you know, a lot of what our attitudes and beliefs are really reflecting a lot of the social context that's out there. Heartbreaking kind of way to show it, but I think, important to really message. And what we know is that this is also relevant for mental health. This is work that we did from European countries. It's focused on adults, but there is a growing number of research looking at these kind of macro and micro contexts, but not too much yet kind of showing empirically that these social attitudes, we have a lot of data which looks at the prevalence of stigma in different countries and different contexts. But then we also linked that with the personal experiences of people with mental illness living in those contexts. And so what we found was that in these 14 European countries, so individuals with mental illness who lived in countries with less stigmatizing attitudes, they had higher help seeking and treatment use, so real important impacts for help seeking and access to care, better access to information about mental health, and they also had lower self-stigma and lower perceived discrimination. So these attitudes clearly have real impacts for people living with these conditions. And we tried to do something similar, that we had just one site looking at in England, but at least trying to link up some of how this pathway between public attitudes and young people's experiences. So we have a community cohort of young people recruited from schools. They're enriched for psychiatric conditions. There's about 432 young people in the cohort. And so what we wanted to do, we were interested really in how these young people perceived their own mental health. And this should be related to then whether they seek help, but also thinking about how stigma might be influencing their own self-perceptions, appraisal of one's own circumstances. So trying to draw the link between how people's attitudes and how that might influence their self-perceptions, and then how that maybe then goes on to link to whether young people are getting help and support. The issue was we had to develop a new instrument and measure to think about how young people are perceiving their own mental health. It was a community survey, and so we couldn't just, we didn't want to just ask, oh, do you have a mental health problem or a diagnosis? So we developed this scale together with Georg Schmiris, the self-perception as having a mental illness scale, or the SELFie scale. And there's 5 items. It's quite simple, but it looks at whether young people think they have a mental health problem, whether they think they're the kind of person who might develop or be at risk of developing a mental health problem, how stable they feel. So we have these 5 different items. Here are the responses, at least from the cohort, and you can see most people felt they didn't have a mental health problem, but they also didn't really think they were at risk. So only 23% said they are the type of person that is likely to have a mental illness. So we then, we used this measure, but we also combined this. We had a stigma measure, a social distance measure. We also looked at whether young people used mental health services, and we also looked at socio-demographic characteristics. And so first, in relation to factors which were associated with having a greater perception of having a mental illness. So we saw that females were more likely to have this greater self-perception. Also, clinical characteristics were important. So PLEs, or psychotic-like experiences, the SDQ, which is the Strengths and Difficulties questionnaire, looking at general types of mental health problems. So those were all important for how people perceive themselves as having a mental illness. But then we also see that social distance, so the stigma measure of social distance, was negatively associated with having a self-perception. So above and beyond, independent from these, clinical characteristics, it seems people who have these negative stigmatizing attitudes about mental illness, they're avoiding this label themselves of having a mental illness. And then we looked at then how this was related with service use. So we found in this case that, again, these clinical characteristics, psychotic-like experiences, the Strengths and Difficulties questionnaire, those were associated with having a greater likelihood of using services. Also, younger people, that's what we kind of noted before. Younger people are more likely than the older adolescents to use services. They probably have less independence. But also this self-perceptions was really important for whether young people used services or not. And then we further did some path analysis, looking at the relationship between these key variables, and found that it seems that these self-perceptions, here how we measured through the SELFie, was a really key mediator between the social distance, stigma, and mental health service use. So it wasn't the social distance independently predicting mental health service use. It was really being mediated through these this self-perception. So people who have these negative attitudes tend to really reject the label of having a mental illness and then do not seek services. And I think this was, yeah, there is some similar work by the colleagues at the Galway group, showing at least here that young people's beliefs, so about other people's stigma towards mental health problems, was a stronger predictor of help-seeking intentions than their own stigma beliefs. I think the link is right, thinking about this really public and social context, how that's important for help-seeking intentions, and it's not just, yeah, that we can't think of stigma just in this individual way. So what can we do? So I think there is a lot of evidence showing the importance of stigma, showing these important pathways of how stigma interacts with help-seeking and service use. It's both parental stigma, young person stigma, and this whole kind of societal impact, which are all impacting on whether young people eventually are able to seek care. I think the good news is that there are several interventions now and a lot of growing evidence about the effectiveness of anti-stigma interventions to reduce stigma. Several different meta-analyses here, especially emphasizing the impact of social contact, but also for young people showing that combined with educational strategies can also be effective. And in the UK and abroad, also several growing initiatives for reducing stigma and a lot of focus on young people. I think when we Time to Change had quite a big focus on young people and reducing stigma among young people. And I worked on the evaluation for that anti-stigma program for some time. And even in the beginning, I think, which is really important for anti-stigma programs, they went to service users, to people with mental health conditions and lived experience, to ask them, who should we focus our efforts on? And I think in addition to asking people with lived experience, also the general public, I think really felt that a focus on young people and trying to address stigma early on is really important. I think what we also know from the literature is that you can't only focus on young people and then you've solved the problem. This is really an ongoing initiative. So it's important. Actually, Time to Change has finished, but there are these other ongoing initiatives, Student Minds, Heads Together, that are out there and that need to keep, are needed to really keep stigma at bay. And so I suppose though, if we think about this kind of complex process though, I think it's also understanding that increasing access to mental health care really requires action at many levels, working together with young people to make sure that any intervention is really relevant for their lived experience. And I just wanted to highlight another study that I have been leading in relation to this. So using the same cohort, we wanted to think about how we could address this issue, but we found, among the young people that we were interviewing, 40% of those with mental health problems actually really wanted to get help. And so it wasn't just that all of them were rejecting help or any kind of support. They felt they really needed support and wanted to get that. But there were, in addition to the shame associated with using care, there are lots of concerns that the young people felt. So they had little knowledge about the types and efficacy of treatments offered. They thought they would just be offered medication and that would just be a temporary fix. And so we decided to try to have a more self-guided intervention and develop an app that would facilitate access to a broad range of different types of mental health care and support, and also allow young people to share their stories and do this in a really non-stigmatizing way. Just quickly to say that we did several focus groups and interviews with young people to develop and make sure the app was relevant, reviewed other types of apps, and also then reviewed all types of different really range of different types of NHS types of supports, but other types of online digital support, and also other types of nonprofit NGO support. And we developed this app called Afloat, and it was important to, from the young people's perspective, that this was non-stigmatizing, that it represented their experience. So the app and logo were derived from a competition among young people, but it doesn't say something about mental health right on the front of it. And so the app includes a lot of different types of information about mental health, well-being, but also links to personal stories and testimonials from young people who found services, and kind of tell a real life story about that sometimes it's difficult to find the right types of support. It takes takes a few times to find the right person that you can work with, a person that you feel has the right attitudes, that it is that there are all of these challenges. So we have these types of stories from young people about their experience, and then information about different types of services, supports, and really try to do this in a non-stigmatizing way. And we found, at least in this case, that young people felt more confident about seeking help following using the apps. This was a month after using the app, that they would recommend the app to other young people. Interestingly, 12% of the sample used Afloat in an emergency situation when things got really bad. So considering this wasn't a clinical sample, I thought that was interesting. And when we were talking with young people, actually in our focus groups, what they really said was that they really just had such unclear expectations of what mental health support looked like sometimes, and so could sometimes dream up something much more dramatic. But also when people said they had, one person said, you know, I had I don't know, taken a lot of medication and was worried about, or was going to overdose, but they didn't know it would happen if they called 999. They didn't know an ambulance would come. They didn't know what to expect at all. And so we tried to explain these different things. And interestingly, 12% of the young people in a 1 month period used it in an emergency situation. And interestingly, found that it increased likelihood of intentions to seek help, reduced actually mental health problems among those who had some type of mental health problems, reduced symptoms at follow-up, and then we didn't find a significant impact on stigma. There was quite a high ceiling effect, at least in our sample when we started. So in conclusion, yes, I think I can say that barriers to mental health care support for young people these barriers are really prevalent, and they can really reinforce these inequalities in healthcare and not only impact on young people's mental health, but really restrict their future life chances. And these really have long-term impacts. For young people, these barriers exist at many levels. So of course, at their own attitudes, but there is also the relevance of gatekeepers and caregivers, peers, and then this kind of wider societal context, of course, which is influencing people's individual attitudes and beliefs and availability of care. And so we also know that stigma at each of these levels, so at the public level, among caregivers, among young people, is a significant barrier to care, and significant even at these very early stages, so, and really impacting on potential prevention options. These stigmatizing beliefs are shaped by our social context. So they can, all of kind of where people live, of course, this is the kind of more complicated social change that is needed to really improve access to care. But it's important because it does influence how people perceive their own mental health, and then their likelihood of getting help, potentially in an effort to avoid that, those labels, avoid self-stigma or internalizing the stigma. And these beliefs can form very early in life. But I think also importantly, we can do something. There are evidence-based strategies, a growing number of resources which can be adapted to different contexts. So of course, sometimes you can't take the intervention off the shelf and use it, but there's a huge number of interventions now which are growing and I think can be adapted, working together with young people to make sure that they're relevant for their contexts. And that there is evidence also that these can not only reduce stigma, but also improve access to care and support. Improving access, of course, then requires a range of strategies. So in addition to reducing stigma, we need to, think both about stigma across all of these different levels, but also how stigma is influencing other factors which relate to access to care. Social contact, of course, is one of the most effective strategies for reducing stigma. And so sharing young people's stories, I think that is really important, hopefully for creating a virtuous cycle where more young people can become aware, and there's a more kind of positive virtuous cycle that results from this social contact. And then digital resources, especially now, are becoming more common, and we don't want to only rely on these. And I think there are different ways we're learning about how you can do different types of support and peer support online, but they may provide some opportunities for minimizing stigma, making it easier to access resources, which then match the personal preferences. Okay, so thank you very much. Yeah, and I'd love to discuss more and take any questions.
Thank you, Sarah, for a fascinating presentation. It was great to see it transitioning not just through stigma, but actually the care piece as well. And that was really excellent. So I'm going to hand over to my co-chair now, Molly, who has been looking at some of the questions in the chat. Molly.
Perfect. First of all, thank you so much, Sarah. That was really interesting. So we have a few comments in the chat, and just a reminder to anyone, if they have anything they'd like to ask, you can do it via the Q&A function. We won't be checking the chat box itself. So the first question, someone was asking for your thoughts on managing teen anxiety accompanied by school refusal.
And school refusal, so where the school refusal meaning?
That's all it says. I imagine it might be by maybe the school refusing to consider maybe the young person's mental health conditions. Whoever asked the question, if they might want to clarify, but.
You can start there at least, but I mean, no, that.
Perfect, or I can go to another one first. And
Molly, maybe go on to the next, because the person who put it in, they might like to maybe contextualize the question within the context of either stigma and things like that. So yeah, maybe we move on to the next one, because I can see a few here. Sorry, perfect. Molly.
Perfect. So the next question is, so they recognize that mental health of young people is important, but parents affect their self-perception, and many parents need help as well with regard to awareness, and they're an important influence on young people in both a possible positive way and often in an ongoing negative way. And so they were asking if there should be a wider target than just young people, in your opinion.
No, absolutely. I think, I think that's right. You can go in. I think, right, the young people are living within a context. All of us are living within this context, but the young person especially are more dependent on their family and that unit, especially very young people. And so I think, there are these different, parenting programs actually that work kind of towards really kind of lessons about parenting and supporting the young person. And I don't think they're usually explicitly really involving kind of anti-stigma interventions, but I think what we see, at least, there's not that many studies that have looked at the parental impact. So I know of 3 different studies really looking at how the parent stigma is impacting on the mental health service use of the young person, but all of them show it is really key. And so I think maybe it is, maybe some of these existing parenting interventions that are out there already, actually we can really try to incorporate some of this anti-stigma work more explicitly. And with all of the youth mental health kind of programs, I think there's a big movement towards and developing anti-stigma programs for young people, which is really important. But I suppose at least recognizing that there is this more complicated web, and maybe other people that need to be a part of that also.
Definitely. So another question we have, they said it was a lovely talk and great data, and they just had a question with regard to the app reducing stigma. And they asked, do you have any other ideas what types of interventions might be best to reduce stigma about mental illness among young people? And a follow-up, are there any evidence for arts-based interventions?
Yeah, no, I think, right, so 2 questions, yeah. So there are right now these systematic reviews, and so I didn't go through even all of the studies in the systematic review. I think the systematic reviews that I highlighted, so at least you can see the references. A lot of them, they pull out the studies which were focused on young people. There are definitely fewer studies which are evidencing that anti-stigma work among young people, and so more work needed there. But a lot of there are some studies, for example, many of them are focused on schools, so running anti-stigma interventions in schools, and ones that don't just do mental health literacy, I think, but also incorporate this element of social contact. So where young people are sharing personal narratives, in addition to feeding back to young people, some of these important kind of, there is an element of mental health literacy. What we found, at least in our interviews, was that some young people really wanted this information just to know about mental health because they didn't have that experience. But I think on top of that, you want to contextualize from young people who have lived experience, and I think that combination, evidence suggests that combination is the best. But yeah, I think you can check. The Student Minds have some great initiatives. Time to Change, it's finished now, but they have some great resources online, especially for working with schools. And Heads Together, I think, is starting some also, and there are also then these other interventions in the systematic reviews that you can check.
Perfect, that sounds great. Another question, someone asked, is there research on how much educational setting can support removing stigma? They say young people spend a lot of time in school and it has a huge role in children's lives and a great gateway for early warning signs.
No, I think so. We focused more on the parents because we had these interviews with the parents. But I think, that's probably coming back to that first question also about, young people having, if we're interpreting it right, but young people having this experience of anxiety and maybe the school not always understanding. There are some work done with teachers. I think there's, not as many, a lot of the work that's done with teachers is a little bit more focused on recognition. It tends to be, or mental health literacy. So how do you identify young people with mental health problems, which is important so that they can support the young people. But I think probably what we need to build in more is, not just, and a lot of the interventions which go to schools is really about educating the young people. And it is, again, kind of a similar story to what we were discussing with the parents. Actually, also need to maybe have teachers on their own and the schools more broadly, thinking of them as, an institution themselves, how they recognize mental health. And thinking about what types of plans and supports they can provide for the teachers also and young people.
Definitely. And then someone asked that the Afloat app doesn't seem to be available in Ireland. Will it be available soon?
Oh, sorry, I thought it was globally. We are relaunching it actually because we've just updated it. I thought it was still available. But we've done some updates, so thank you for letting me know that, and I'll make sure it's available in Ireland too. We didn't map out, so we have all the digital resources and stories, and we were only able to, it was a huge task to map all the services in London, the physical services, but at least for So we won't have physical services in Ireland yet, but we'll have all the other types of information.
That's great. Thank you so much. If anyone, someone asked, were there many apps you drew on when designing a float? So were there any apps that inspired you or anything?
Yes, there weren't too many apps for young people really about helping them access care. So of course there are some really great apps, and we were talking with Headspace and these other initiatives which I think are popular and really reaching out to people about supporting their mental health, and more kind of as a design and features. I think we've spoken with some of those apps, but there's fewer that are out there that are really improving access to care. We've just done a systematic review actually on digital interventions and how they can improve access to care. So we have found a few, but there are not many that we're able to draw on. So it was more on working with young people themselves. Yeah.
Fabulous. That's really cool. It sounds really innovative. And there's some questions in the chat as well. Someone asked, what are some evidence-based strategies aside from social media and digit?
Right. So I think this, and maybe this social contact, I think is such, maybe I didn't talk enough about it. So, and this social contact really where people with mental health problems are sharing their own personal narratives. And I think, before COVID days, actually, there are some really great initiatives. There's this one I would recommend actually looking up called Living Libraries. So I don't know how possible it is, but hopefully soon, maybe. But yeah, where people, it was usually in a public space, and you can people with mental health conditions or different types of experiences would be there, and you can go and take this instead of taking out a book, you take out a person for 20 minutes, you talk with them, and the idea is really, they can talk about their own personal experience to break down these myths and stereotypes. And I think there are lots of different variations that can be done based on that. I guess adapting to our current context. But it is finding these creative ways to allow people to have that social contact connection, I think, which has the strongest evidence base for reducing stigma and discrimination.
Perfect. And then I suppose we'll have one final question to end. Someone asked if you could share other initiatives or tools you could recommend aside from a float in the southeast side.
Maybe I can. If I share the slides, maybe there will be some references in there, and I can try and think if there are any other initiatives. Put links in there, just so because I think that is so important. These practical resources, right? We have all this. It's even so. I went aside, but when we come back to the digital resources, there's a lot of research about digital apps, and there's a huge growth in the market about digital apps too. But if you look at the intersection, there was a systematic review which looked at the intersection between those ones that had evidence and then the ones that are still available on Google Play. So all the ones that are still, I don't know, a big proportion of the ones that are available haven't been tested, and then the ones that have been tested and have evidence actually are no longer available on online. But I think it's such an important point, right? There are some practical resources that have evidence base, and so I'll try to highlight those in slides if I can share those.
Thanks very much, Molly, for chairing that Q&A. Sarah, we're actually at the end of our wonderful session with you. I really am delighted that you shared your talk and all of your insights as well. And I can see somebody has just reacted there saying, grateful for your informative sharing and service. So I think that's often even the learning that we get from the Q&A at the end is as much as the presentation. And the fact that you said you could add some resources to that, I think people would find really, really helpful, because sometimes people want tips and resources, particularly because we will have people on this call that we have everybody from an interested family member, maybe a person with a lived experience themselves, practitioners, researchers, etc. So and lots of people look for different things in a presentation. So thank you, Sarah. I think you covered all of that from the researcher all the way through to anybody who has just an interest in the area. And so many thanks to you. We're just coming to the end, but before I finish off, obviously would like to thank my colleagues here in UCD who've also been part of the week, which was Eilish Hennessy, who's kind of leading out of the seminar series, Dornia Murphy and Neil McDonegan, to name just a few who are part of the YouLEAD programme. And just to remind people that our final seminar tomorrow is on mental health supports in schools, because I know we had a question about school refusal earlier, and actually the person who put that in may like to join tomorrow's seminar because they may find that particularly interesting from that perspective. Tomorrow's talk is mental health support in schools. What does the evidence say? And our speaker is Jessica Dighton, Professor Jessica Dighton from the University College London. That will be the last in our Youth Mental Health Research Week. So many thanks to everybody for joining us today, and thank you to Sarah and for giving us some great insights into the research and the practicalities as well of using the data in a meaningful way. And Eilish has popped in the Eventbrite for tomorrow's seminar, so if you're interested you can register there. So just that, and will be the last one of this particular series. So I will finish by saying thank you very much, and thanks to Molly and Eilish as well. Thank you.